Hello, I'm Nick Nicholson. I was Judy Nicholson's husband for 47 years. We're here today to talk about kidney cancer. We're here to talk about the Judy Nicholson Kidney Cancer Foundation. And we're here to talk about all the people who need help, who we want to help. So I want to tell you Judy's story to let you know how we got here. As I said, Judy and I had been married for 47 years. We had 2 children, 7 grandchildren at the time of her passing. Judy had never been sick. One day in February of 2008, she came home bothered, said she had fainted. Well, Judy had never been sick in her life, had never been in the hospital except to have 2 babies. This caused us some concern, of course. We were fortunate to be able to be admitted into Mayo Clinic of Florida fairly quickly. After various exams, turns out that Judy had a massive tumor in her right kidney calling for surgery. This was a jolt. We had the kidney removed. I say we because I felt like I was there. She had the kidney removed. We were so optimistic. At the time of the surgery or after the surgery, they told us that the surgery went well. They had found tumors in some of her lymph nodes. There were some spots in her lungs. It had migrated into her smaller vena cava. The cancer was removed from there, surgery in the lymph nodes. We were so wonderfully optimistic. We had wonderful doctors. We had wonderful care. Our attitude was positive, and soon afterwards she began to take some medication to work towards removing the cancer or causing it to go away. Some would call it chemotherapy. I'm not sure that's the proper term. At any rate, in August of that year, same year, some few months later, the kidney cancer had returned and metastasized into her spinal column. This called for another surgery. It had migrated into her spinal column, causing the surgery to remove that, to replace a prosthesis in her spinal column. As a result of the surgery, she was partially paralyzed on her left side, her left arm, her left leg. After August, it was so problematic. It was painful for her. I became a major caregiver, taking care of her. All the things that one would do to a loved one who's partially paralyzed and ill. In October, Judy died. She died from the result of kidney cancer, bearing in mind that she had never had any history of kidney cancer in her family. There were no markers, no precursors to this cancer. There was no blood in the urine, no blood in the stool, no swelling. There was a little bit of fatigue leading up to this, but at the time, Judy was 67 years old, and we were thinking it was fatigue due to age. She was also a marvelously successful residential saleswoman, and the combination of age and her incredible work ethic probably helped her in one sense, but masked any other sign that might have been there. During the dying process, we talked to Judy. I talked to her at length. We felt so helpless. There was no support group in Jacksonville. There was no support group in the region. There was no one to talk to during the whole process to ask, what did you do when you took Sutent? What happened after surgery? What options are available? What would you be your preference of one drug over another? We had wonderful support from the doctors from Mayo Clinic, Florida. But this doesn't take the place of another person who's walked the same path you're walking. With Judy's consent, even before her death, we agreed to form the Judy Nicholson Foundation. The purpose initially was to raise funds for early detection of kidney cancer and to find support for those patients, caregivers, and survivors of kidney cancer who were on the same road. We consequently, in February of 2009, formally established the Judy Nicholson Foundation, Inc., an IRS-recognized 501c3 charitable foundation. After some months or a couple of years, we determined that trying to raise money for early detection was not our strong suit. We found, and we've discovered through time, that what's really needed is someone to help other patients, someone to help form and establish support groups, someone to give them comfort and solace, someone to be there for them. And so where we are now, our goal is patient support and education. We have seminars that are free that we give. They're free to patients, caregivers, survivors, professionals. We want to help and educate and inform. Some of the many options that we weren't fully conversant with would have been clinical trials. I frankly don't know if, because of the stage 4 diagnosis of Judy's condition, whether clinical trials would have been an option. I'm sure our doctors told us about it, but you can understand much of that became a blur because of the pain and sorrow and anguish we were going through. But it wasn't a big item. So clinical trials is really something that's important for people to get to know and understand, because it's not a requirement, it's just something else. As a carpenter might have more tools in his kit, this is another tool in the kit to perhaps help cure and run down kidney cancer. We now have a board of directors. We have people working hard every day to help other people. We want to help other people. We want to help you if you're in need. As we evolve, we need more people to join us in this fight, to help us become more aware of kidney cancer. It's one of the lesser known cancers. It's far behind in terms of recognition, such as breast or prostate or lung. But it's one of the more deadly. Those of you that pay attention to this would know that the death rate from kidney cancer is rising. The mortality rate is rising. Instead of the trend from other cancers, such as breast cancer, the mortality rate is decreasing. This is due to early detection, awareness, research, funding. The mortality rate from kidney cancer is increasing. This is why while it's unrecognized in the large scheme of things, it's deadly. And more people need to know that. We need more awareness. We need more funding for research. We need more funding for patient support. We need to help people. We want to be able in the future to fund folks who are not as fortunate as we are, who might need financial assistance even to seek treatment from this awful, awful disease. So with this having been said, I want to thank you for your time. I want to thank you for listening to my talk about kidney cancer. And hopefully you'll leave and be in a better position after this seminar and after this talk to help other people, to be more aware of what you can do and what we can do together. Thank you.